Welcome to you at thr.net from Jessica Perkins and myself, Dylan Human, and we have a great pleasure to welcome Dr. Derek Yach. The topic of today's discussion will be the potential impact on health in the US and globally of the Trump administration. First, a quick word on Dr. Yach. Derek is one of the few individuals where you can say he's a multi-stakeholder individual in healthcare. Derek has had a storied career in government and then in intergovernmental agencies where he was the director at the World Health Organization and one of the architects of the Framework Convention on Tobacco Control, and then spent some time in academia at the Yale School of Public Health, philanthropies, and also the private sector. Derek, it's a great pleasure and privilege for us to welcome you.
Thanks,
I'd like
Dylan.
to ask you, I'd like to ask you about the upcoming Trump administration. Now, many in global public health are slightly concerned about the impact of a second Trump term on public health in the USA, but also globally. Could we first just talk about the potential domestic impact?
Yes, and obviously it's very early days because we really have the names of the people. We have some sense of their backgrounds. So we need to have a lot of caveats because somebody always reminds me that food is often eaten at a different temperature at which it's served, which means that the initial hot discussion and debates that you may hear during the early phase may very well be tempered in the reality of delivering services to people. But let's see what we've got. So the head of Health and Human Services is Mr. Kennedy, who has a background in promoting chronic disease prevention on the good side, and that can only be good for the nation. He also has an interest in harm reduction, and some of his early comments about psychedelics and the importance of not criminalizing people for drug behavior, as well as maybe his own personal use of nicotine pouches, suggests that he will be open to a wider range of harm reduction approaches, which is a good thing. Against that, of course, we have concerns about his vaccine statements, which have already been tempered to an extent, and I'll get back to that later. One brief comment is that we've always got to compare his passion and background to the current administration's head of human health services, Becerra, who hasn't got a health background as well and came as Attorney General of California. He's been largely invisible. My own view is that having somebody who can passionately talk about chronic disease prevention is exactly what the nation needs, and that may very well be better for public health. In the NIH, we have Jay Bhattacharya just announced, with an interesting background in medicine and economics, and it suggests that he may be asking wider and tougher questions about the effectiveness of the investment of the NIH. He may very well be led to ask questions like, why is it that the outcomes in terms of health in the US are so much poorer compared to OECD countries, despite them spending twice as much in terms of per capita expenditure on health and vastly more in terms of their entire research agenda? Just asking those questions, I think, will raise important opportunities to think about prevention again. My own work showed that the NIH probably spends about 5 to 6% of its $48 billion budget on prevention, something I'm sure they'll look into. Then we get to the FDA, where Marty McCary appears to be well qualified with an MD and MPH from Hopkins, and also a passion for chronic diseases. We don't yet know his regulatory goals and approach, but from a qualification point of view, you have somebody who should be well placed to actually lead an agency that plays the world's leading role on the regulatory side of tobacco, pharmaceuticals, vaccines, medical devices, and also food. With regard to David Weldon at the CDC, I would be a bit worried. I've always believed that the CDC is best led by somebody with a strong public health background, which he doesn't have. But remember, again, in the last couple of years, we've had people with mainly infectious disease backgrounds against a backdrop of when the predominant health outcomes across the country are chronic diseases. So this may actually be a chance to start taking a different perspective. The last person to really have a strong background in both chronic and infectious diseases at the CDC, I think, was Tom Frieden. But he had strong backgrounds in both. And then finally, the Surgeon General, Janet Neshwarat, has a very strong media presence. By all accounts, she has a tempered, fairly science-based approach to her comments. And I think having somebody who comes with a strong media background is really essential, particularly if you're going to counter a lot of the disinformation we have out there about, for example, vaccines, nicotine effects, what you should eat and what you shouldn't eat. And again, as in the case of Becerra, we've currently got a Surgeon General who's been largely invisible, though puts out very nice reports on loneliness and mental health. For the vast majority of people, at a time when social media is so crucial to informing public policy, we haven't really seen much of him. In brief summary, I would say that the opportunities for chronic disease prevention in the US may very well be good, particularly given that what we've heard for an RFK has been a strong need to focus on physical activity, a strong need to focus on broader aspects of prevention. And in that, we hope that he will be guided by looking at a very interesting past commission I was involved in, looking at prevention, led by Vitality, and involving multi-stakeholders across the country, recognizing the power of increasing physical activity for many reasons, having a healthy diet, moderating alcohol intake, and obviously ending smoking, but ending smoking through the use of tobacco harm reduction products that are already approved by the FDA. I would just say, Dylan, before you get onto the globals question, that I've been privileged to work in many ways with all of these agencies, the NIH, the FDA, the CDC, and past Surgeon Generals. And I would say overall, I would say that we have a reasonable chance of expecting good outcomes if they go in the direction of focusing very heavily on chronic disease prevention.
Derek, that's an encouraging view, and thank you for the summary. Just for our viewers, at the bottom of this video, you'll see some links to work that has been done by Derek on prevention. There's a TEDx talk, and there's also the Vitality Report, and I would urge you to click on these links to see some excellent work that might be very relevant for a Trump administration. But Derek, if we can turn to global health. So you've spent most of your career in global health. And with this new administration, especially with the early signals saying that they might cut off WHO funding, they might have cut off funding to low and middle income countries that don't support US policies. What is your early sense on what might happen to global health from a US perspective?
Yes, and I think you're right. I think a very interesting decision will be who do they appoint as head of global health inside the USAID. I think some of the macro decisions will be up to Marco Rubio and RFK to think through, given that the role of state in the UN agencies is also important. There are some dark clouds, very dark clouds. I think anybody who really wants to know what may very well happen should take a read of Project 2025, Chapter 14, which has very detailed accounts of how reproductive health will suffer globally. The US will be obliged to withdraw funding, stop engagement, and reduce interaction with agencies that are involved in anything that may come close to reproductive health, and more specifically abortion. This would include UNFPA, WHO, UNICEF. How that plays out, I don't know. But we certainly need to make sure that the overall benefits of these agencies are projected far better than they currently are, so that they don't lose out dramatically, given that the US is such a major funder. This will have a chilling effect, not just on the UN and related agencies, but on the nonprofits and the funding that is supported worldwide through the US government, through a range of NGOs, and could set back progress that we are making in women's health and reproductive health at exactly the time when we need to continue with the progress. I also think that the other potential dark cloud relates to comments about vaccines and what works and what doesn't work. It's going to be really crucial that we have clear, strong statements that keep reminding us that vaccines save lives. And that would mean starting to support even more Global Vaccine Initiative, Gavi, UNICEF, and the others that are actually involved in programs that save lives. Having mentioned the dark clouds, one always needs to look for the positive opportunities. And I mentioned that I've been involved in many initiatives globally and even in our WHO with federal agencies. And I have no doubt that when CDC engages globally through WHO, through national programs, it leads the world to be a safer place in terms of global surveillance for infectious diseases and for non-communicable diseases. It provides strong guidance and training in basic epidemiology around the world, particularly in Africa and Asia. And very significantly through USAID and other programs, it funds the world's most successful program saving lives by any developed country, PEPFAR. And my earnest plea is that the administration takes a very careful look at how PEPFAR is one of two major gems it's already got in an armamentarium to project soft power across Asia and Africa, at the same time as saving millions of lives. Withdrawal or reduction of support for PEPFAR translates into people dying. That's as simple as it is. It's not a long-term effect. It's a relatively short-term effect. Everything that can be done to maintain and protect and enhance PEPFAR is needed. And I would say that the chronic disease agenda is long overdue for being linked to PEPFAR. Many of the people on AIDS treatment and TB treatment around the world smoke and have hypertension. Yet PEPFAR has been forbidden to now from actually addressing the fact that they do smoke and that they do have hypertension, meaning that they may be being successfully treated for AIDS, but they will go on to die of chronic diseases and cancers. The second gem I would mention, maybe is the last one, is the NIH Fogarty Center. That's the NIH International Center. And for a decade, I served on the board. What I saw was the incredible way in which the $48 billion of the NIH was actually able to be spread around the world for public good. It wasn't just a case of it improving the quality of science, but it was building communities who would want to work with US institutions to do good in their countries. But also, the US would have the eyes and ears of countries around the world to learn why it is in some areas that they do better than the US does and learn from that process. So my strong view would be that as the NIH is looked at, don't forget about the Fogarty Center. It was developed under a Republican administration. It has for decades stood the test of time. It's severely underfinanced, and yet it's the road to building the science capacity around the world that would make it easier for the US to interact and engage with low middle income and all countries in trying to promote a world in which there are safer, healthier products. And within that, of course, the one passion I always had around tobacco harm reduction would benefit as well.
Thank you, Derek. And similar to your plea that PEPFAR especially and its role would be strengthened, came the blog this morning from Bill Gates, who echoed exactly the same sentiments and spoke of the 25 million lives having been saved by PEPFAR. So we couldn't agree with you more. And your very interesting point was to link PEPFAR to non-communicable disease. So the next question is really about the impact on tobacco control, harm reduction as part of tobacco control, and how that might play out in the new administration.
Again, a lot of tea leaves to be read, but I can give a mixture of what I hope and what I think. I think you've got an open-minded head of the FDA who will inherit an agency that's been really sluggish and slow in the authorization of products that can save lives and are saving millions of lives around the world. I think that the time is long overdue that the FDA speak up about their experience and their view that heated tobacco products, snus, nicotine pouches, vapes, do save lives. And that is the reason why they declare some of them appropriate for the protection of public health. If they're declared appropriate for the protection of America's public health, they must be the appropriate protection of everybody's public health. Yet no FDA head has ever made that clear statement at a WHO meeting or within one of the Conference of the Parties meetings, which would actually start turning the table towards recognizing that of the 8.5 million lives that we have being lost every year to tobacco, many of them would be prevented and saved by the use of these products. What's holding up is a mixture of anti-scientific dogma and a strong resistance to recognizing that many of the very companies that actually have created and continue to create the problems of tobacco deaths are dramatically transforming to see their future in saving lives. Is that likely to go forward? I would hope so. And I would imagine that if you've got open-minded people, some who may already recognize the value of the product to their own health, to their own mental stimulation, and probably recognize that nicotine is virtually an inert product, and that is certainly not the problem. The problem is the smoke and the toxic substances in some of the oral tobacco products of South Asia. A careful look at the evidence that has been growing over the last few decades. Very well reported in the Lancet, in the JAMA, the New England Journal. 15 presidents of the Society of Research in Nicotine and Tobacco have made the point about the value of these things. Listening to the scientists, looking at the data from a new perspective, and recognizing that the current administration has really been far too slow to act against the world's most preventable cause of death. I feel very strongly that there is an opportunity for us to take a new approach forward, both domestically as well as globally.
Thank you, Derek. And may I ask, are there any diplomatic means in which American best practice in tobacco harm reduction can be exported globally?
Yes, I think there are many ways. The first is directly through the WHO executive boards and governing bodies, that the US
Yes.
representation has been relatively weak under the Biden administration. Shortly after inauguration, about a week after, in late January, the next executive board sits. It'd be fantastic if we had a representative of RFK sitting there expressing what their view needs to be and what they're planning to do globally already at that stage, even though it'll be in very brief terms, to do two things: to stabilize and hopefully allay deep concerns and fears that the administration is intent on rolling back the progress we've seen in global health, particularly reproductive health and vaccines, but that it wants to engage positively in helping to support, guide, and invest in those things that'll improve the agenda of WHO, which is effectively the agenda of RFK and what will probably be the agenda of the administration to promote health and longevity.
Thank you, Derek. That's an excellent summary of what might happen, and I'm especially encouraged by some of the silver linings that you've outlined to us. Thank you very much for sharing your expertise on thr.net. Thank you very much.
Thanks, John.